I am Eric Baitchman. I'm the Vice President of Animal Health and Conservation at Zoo New England. And I'm going to be talking now about One Health and the importance of biodiversity in protecting human health. One Health refers to the fact that human health, animal health, and ecosystem health are all interconnected. It's an understanding that humans exist in an ecosystem shared by many other beings, and that the health of all is interdependent on each other. With that understanding, we will come to know why the preservation of biodiversity is so critically important to our own preservation. Practitioners of One Health come from a diverse array of disciplines, ranging from veterinarians and physicians to public health, microbiology, environmental health, social sciences, economics, educators, politicians, and many others. And bringing together a broad array of disciplines brings valuable expertise, skill sets, and the diversity of thought required for solving complex health problems. There is an immediate need for one's seemingly disparate fields to understand their context and common goals serving planetary health. So we're all at home right now. We're unable to come together physically as we normally would for our Zootopia celebration because of the coronavirus. COVID-19 is very much a One Health problem. And while the exact source or the exact path of emergence for this virus is unknown, we do know that the virus originated in bats, as was also the case with two other coronavirus epidemics that we've witnessed, with severe acute respiratory syndrome from the SARS virus in 2002 in Asia, and the Middle Eastern respiratory syndrome from the MERS virus in the Middle East, predominantly in Saudi Arabia in 2012. And you can see on the graphic on the bottom that the one in the middle there that's labeled SARS-CoV-2 is the current virus. So the name of the virus is SARS-CoV-2. The name of the disease is COVID-19, just for some clarity there. And COVID-19 stands for coronavirus disease 2019. So just as with SARS and COVID-19, both appear to have originated in wet markets, like the one shown here. And I apologize for that graphic image, but it's in these crowded markets where wildlife of all sorts are brought both alive and dead, where they're sold for human consumption. And in these dense and crowded conditions, it's easy for viruses to jump from one species to another, where they can potentially recombine in new hosts to a form that can then infect humans. And I'm sure you've heard that intermediate host for COVID-19 is potentially pangolins, potentially snakes. We don't really know that yet. And in the last 20 years, a number of terrible diseases have emerged through similar pathways, where trafficking of wildlife for human consumption or alterations in land use, such as logging and mining, or clear-cutting forests for expansion of farming and livestock, have brought humans into increased contact with wildlife. Loss of habitat and the degradation of biodiversity in these regions is obviously bad for the wildlife that lives there, but what we need to finally understand is that it's bad for us too. To give you a little bit of more background on the diseases you're seeing there. The top three are the different coronaviruses that I just mentioned on the previous slide. Ebola is another virus similar to the previous three that is believed to have originated in bats. And avian influenza, or the bird flu, as you may have heard to it, as referred to the bird flu, that probably came to people through interaction with wildlife and domestic species like pigs, because pigs have the ability to become infected with both avian influenza and human influenza. And inside the pig, the virus was able to recombine into a new form that could then infect humans. So these all have to do with interactions with animals and people in novel ways. And where globalization has made the interconnectivity of all humans and animals on Earth that much more intimate and profound, we have a responsibility moving forward to apply One Health principles and act as a global community. But these threats of disease are not just from places far away. We've created similar conditions right here in New England. Everybody's familiar with Lyme disease. Lyme disease is a great example of a One Health concept right here at home, and one that is very familiar for us in the Northeast. By now, everyone knows Lyme disease comes from ticks, and most people usually associate the disease with deer. What people typically don't know is that mice have more to do with spreading the disease to humans. Mice can carry many, many ticks, and they're also good hosts to the bacteria that cause disease. The fragmented forests and disturbed habitats that we create in typical suburban environments serve to promote mouse populations. And healthy forest ecosystems with a rich species diversity can actually provide a protective benefit against human infection of Lyme disease by a phenomenon called the dilution effect. A wider range of hosts are available that are less prone to transmitting the disease, making it much less likely that an infected tick will find its way to a human. So if you look at that, the little box at the bottom with the mice and the person on the right, you see, that represents the suburban environment where we just have little forest edges and little patches of trees, not a robust, healthy forest ecosystem. So that environment really supports mice. So there are more mice, more infected mice. And when the ticks leave the mice to look for another host, to have another blood meal, they're way more likely to encounter a human and infect a human with Lyme disease. The left side of that box, you see there's the infected mice, the little green guys. But when a tick is ready to leave those mice, they have a wide variety of other hosts that they may come into contact with. They're much less likely to spread the disease to people. The opossum that you see there is a real champion for preventing Lyme disease. Opossums, I should say actually that mice really do nothing to groom the ticks off of them. Opossums, however, will groom off and eat at least 90% of the ticks that get onto their skin. And they even will go into the underbrush and eat ticks that they encounter. A single opossum can eat as many as 5,000 ticks in a single season. They are real champions. So that here is a very relatable example where the preservation of biodiversity can have a positive impact on human health right here in New England. So what are we doing about One Health here at Zoo New England? For the last several years, we've been teaching a One Health clinical elective for senior Harvard medical students. Our goals for the students are to expand their perception beyond individual medicine of humans and appreciate the power of transdisciplinary collaboration in improving the health of all beings on our planet. We encourage students to think about the commonalities of medicine and physiology across all species, and to think about individual health within the context of the overall health of the ecosystem. Now, core to our mission at Zoo New England is the preservation of biodiversity and saving species from extinction. So showing medical students how biodiversity is actually beneficial to human health is a very exciting and rewarding experience. The students experience a 4-week rotation, accompanying our veterinarians in their daily clinical practice. The students have all been incredibly engaged in all aspects of our cases. They're eager and excited to learn as much as they can, while also teaching us the newest advances in human medicine. It's truly a rich exchange, and is as rewarding an experience for us as it seems to be for them. The clinical cases of comparative medicine that they see daily are the context in which we introduce much larger concepts of One Health through reading assignments and discussion. Our One Health elective has attracted a lot of attention nationally. Some of you may have seen this article from a couple of summers ago, which made the cover, made actually the front and back cover of the science section of the New York Times. We've also been covered on NPR, NBC Nightly News, CBS Saturday Morning, and many other outlets. If you're interested in trying to see any of those, I would really encourage you to try to find the CBS Saturday Morning piece, which was very well done. You could probably find that by just Googling Zoo, Harvard, and CBS Saturday Morning, or Zoo New England and Harvard. Now, one of the more exciting research avenues to arise from our relationship with the medical school is a collaboration with the Broad Institute of Harvard and MIT, using next generation genomic technologies to investigate potentially heritable diseases of zoo and wildlife species. We're currently undergoing 4 pilot projects looking at heart disease of meerkats and gorillas, amyloidosis in black-footed ferrets, and infection susceptibility of wild timber rattlesnakes to an emergent fungal disease. What's exciting about these projects is that they not only benefit our ability to sustainably conserve species in healthier managed populations, but through our connections with the Broad Institute and the medical school, we're working with local researchers to also inform the same diseases in humans. And in the case of the rattlesnake work, we can also tie in ecosystem health as well, where we're studying how habitat loss for rattlesnakes may have led to isolation and inbreeding in certain populations that could lead to decreased immunity. Another example of a program that we've recently launched is a partnership with the Mass Cultural Council and the Harvard Street Neighborhood Health Center, who are our neighbors right across the street from the Franklin Park Zoo. The Culture RX program is an opportunity to bring together healthcare providers and cultural institutions with the aim of promoting healthy families. We've teamed up with our community health center to give family memberships to families that meet healthy benchmarks, such as completing children's vaccine series and maternal postpartum visits. And going to the zoo is good for your health. The health benefits of connecting people in nature have been known for a long time, but research supports that nature has positive effects on people's health, physically, mentally, and emotionally. And zoo-specific studies, in fact, have shown that people felt happier and more energized, had a significant decrease in blood pressure, and decreased mental stress after visiting zoos. So I hope you all will get out and visit us at Franklin Park and Stone Zoos just as soon as you're able. And of course, Zoo New England is doing our part to preserve and enhance our local biodiversity. Hopefully you were able to attend our earlier webinar by Dr. Brian Wynn-Miller, and you got to see the important work our conservation department is doing to save rare species right here in Massachusetts. As we protect and augment local populations by engaging local classrooms and communities in their care. I can give you a quick tour of the species that we're looking at here. From left to right, top to bottom, that is Blanding's turtle, marbled salamander, the eastern spadefoot toad, American burying beetle, the eastern box turtle. That I'm actually highlighting the plant there that butterfly is visiting, and that's a native plant species called New England blazing star, which is a really important source of nectar for pollinators, especially migrating monarchs in the late summer and early fall. That's a bridal shiner, that fish species in the middle, and butterfly milkweed, which is also another important pollinator species. We're also protecting wildlife around the world. We have, working with many different partners, we are engaged in programs that are protecting the cross river gorilla there. That's the most endangered subspecies of gorilla. We've been involved since 2006 as a founding member of the Panama Amphibian and Rescue and Conservation Project, where we have captive assurance colonies of amphibians that are going extinct from another significant One Health issue, which is a fungal disease called chytridiomycosis, which is decimating amphibian populations around the world. But Panama is a real hotspot for that. So there's facilities down there that have species that are in fact extinct in the wild, such as the Panamanian golden frog, and other related species like this harlequin toad that you see there. We've actually started reintroduction projects experimentally down there with that program. We're also involved with the Snow Leopard Trust, protecting snow leopards in Mongolia, the Baird's Tapir Survival Alliance, protecting Baird's tapirs in Costa Rica. That's a Cuban solenodon. It's a new project for us working in Cuba on this exceptionally unique and rare mammal. Working with giraffes in Uganda. And that's a Hecate turtle, also known as the Central American river turtle, that we're working with in Belize. So thank you all very much for your attention, and I'm really looking forward to answering some questions. But I first want to thank our sponsors for the events today.
So we do have a few questions that people have asked. Hopefully some more will flood in as you start speaking to these. We have one here. Someone's asking about if there are specific diseases that you know of that are affecting our animal populations, but that humans may seem to be immune to.
Chytridiomycosis is the one that's really the most devastating. There's no other disease that's affecting more species than that anywhere on Earth. And that's a primitive species of fungus that amphibians are exquisitely sensitive to. It's unclear where it arose from originally, but it is clear that it's been spread all over the Earth by movements of wildlife. We as humans have shipped amphibians all over the world for food and for research purposes, for the pet trade. And with them, this chytrid organism has been carried along. And when it gets into an environment where the frogs have no immunity to it, especially when you get into a situation like Panama, where the populations of amphibians that are there are just so dense. There's just so many of them there. It's very easy for a disease like that to just sweep through and be absolutely devastating. As I mentioned, it's creating extinction events for some amphibian species around the world, including the Panamanian golden frog, which we're working with in Panama. And I'm sure there's other questions, but I'm going to tell just one little anecdote about my experience in Panama and just how devastating this disease is. This one of the goals of the project early on, when we were first involved, was to go out to places that had not yet been hit, because we knew the disease was coming. We could actually see it progressing along a map. So we would go into areas where there were potentially sensitive species that were at risk of going extinct when the disease arrived. And we would work with our partners to collect males and females to try to establish an assurance colony to protect them as the disease came through in a biosecure captive environment. So I was lucky enough to go on one of those field trips, and it was just astounding how many frogs were out there, all kinds of species. The sound at night was just deafening. You literally had to watch where you stepped, because you may step on a frog. And we went back the following year and it was silent. You could hear a single frog call from over there and another single frog call from way off in the distance over there. It was just heartbreaking. So that is by far the most devastating disease among animal species.
You spoke about wet markets. Someone here is asking if there are any other ways that we might possibly reduce the transmission of diseases from animals to people and vice versa, reducing things that could possibly be transmitted from people to animal populations.
Yes, there's some really good and hopeful examples of successful programs. What the factors that are at play here, we need to understand that in many parts of the world, people are struggling to take care of their own families. And when opportunities like logging come through or mining operations, they delve into new areas of the forest that, there isn't typically the same amount of interaction between people and the wildlife. And if you follow these logging roads in, there's nowhere else to get any food either. So there, people are hunting local wildlife and consuming animals that they wouldn't normally consume. But, very often you find that local communities that live in these areas that are really ecologically important, they don't want to do logging, for instance, but they don't have any other choice. They don't have any other source of income. And what would you or I do if faced with the need to feed our families? So there are great organizations like a group called Health and Harmony, where they are working with those local communities in ecologically important areas to go in and understand what do they need to be able to be stewards for their environment. And inevitably, the answer has always been, in any of the places that they've gone, access to healthcare and sustainable livelihoods. And we are going to be working with them on a project in Madagascar, which we would be working with the Harvard Medical School again and the Brigham and Women's Hospital to work together as physicians and veterinarians and biologists to provide better healthcare to the people in those communities, and thereby reducing their need for income, because healthcare is typically their biggest need for expense. Their biggest need for income is based on their need for healthcare. So we've been working towards that end, which all has come to a little bit of a halt now with the coronavirus. We're still working towards that program, but we're going to need to work a little bit harder to figure out how to support these communities during this pandemic.
Thank you. Nichelle piped up during that and asked a somewhat associated question of, by studying different kinds of animals, do you think that some of these studies of animals and their diseases would one day help us find a cure or a treatment for humans?
Yes, I think that question is referring to the genomics work, where we're studying things like heart disease in meerkats and gorillas. And absolutely, yes, this is something that is going to benefit meerkats and gorillas, and it's going to benefit humans. I'll give you an example that with those two models in particular, we're working with a lab at the medical school that studies the genetics of cardiomyopathy in people. disease of the heart muscle. And they're very excited to be working with us on that because, anything that we can learn about the biological mechanisms of the disease in meerkats or gorillas can absolutely be applied to what we already know about the disease in humans. So we may be able to, in any of these examples, help inform new avenues for research that could yield treatments, new diagnostics, and better understanding of why the disease occurs in the first place.
We have another question relating to the work that you're doing with the Harvard Medical School residents. What is that learning experience like for them, and what is it like for you?
Sure. Well, the medical students, what most of them share with me is, I suppose, some wonder and surprise at how easy it is to understand. I mean, they're really, I talk about One Health. There's another term called One Medicine, which really, I mean, medicine is all the same. My biology is not all that different from any other mammal, to be honest. And understanding the physiology of a person is very easily applied to the physiology of other animals. So for them, they do enjoy it quite a bit. I mean, we have so much positive feedback, and we accept 6 students a year. It's 1 month for each rotation, and we accept them all through the spring semester and half of the fall semester. And every one of those opportunities has a waiting list. But the thing that's most gratifying is expanding their awareness about these One Health issues and understanding the importance of biodiversity and ecosystem health. They don't learn that in medical school, and we're trying to increase their awareness. And we had a student that was here with us in March, who has been I've been staying in touch with because his rotation got cut in half, and the irony that and that's because we had to close. The medical school canceled the rotations for all the medical students. So, the irony of the fact that he's here learning about the origins of these types of pandemics and how to deal with them and be better prepared for them in the future, and that learning was canceled by the pandemic itself. But our experience with these students is just tremendous. It is so gratifying. I mean, these are Harvard medical students. Many of them already have PhDs, in fact. And these are the best of the best. They are so smart, so bright. They're so very engaged in what we're doing. But we learn so much from them as well. They definitely help us to appreciate potential new treatments, for instance, where they know all the newest and best things for people that we wouldn't necessarily be exposed to without them being here.
This is really, really exciting to hear about how you're taking so much work outside of the walls of the zoo. I think we have a really great summing up question here from an audience member saying that a lot of what you're talking about is not necessarily the first thing that someone thinks of in association with a zoo. Why is it that you're doing all this work?
I mean, what I've tried to emphasize during the talk is really why I'm even a veterinarian, to be honest with you, and why I wanted to be at a zoo, because this is where the science is happening. This is where the conservation is happening. And things like this One Health program are a perfect marriage between, our connections with conservation and people. You know, and this is what excites me, you know, as a medical professional, to be able to apply the science of medicine towards the science of conservation. You know, the zoo and other AZA accredited zoos around the world, you know, most of which are here in the US, you know, their missions are conservation. Their missions are to educate and inspire people to appreciate nature and to want to protect it, and to empower them with the means of doing so. So this is why I'm here at Zoo New England, and this is why AZA zoos exist.
Thank you so much for that. And thank you for your wonderful discussion. You've really taught us a lot today.
Yep, and I'll encourage everybody again to check out the auction. Please donate generously. You know, come spend some time with me. Get into the bidding on that particular item. Thank you very much, everybody. Be well.